Thank you so much, Trevor. Good morning. Good morning. We've watched the video, right? You saw how those young people were relaxed. They were enjoying themselves in that youth-friendly center. Very demure, very courteous, So that is how adolescence wants to be treated. So my name is Mariah, as you've heard, and I'm from AFNI, that is Africa Free of New HIV Infections, powered by WACI Health. And I'm going to give, my presentation is going to be an experience on HIV prevention and available options for AGOW. So I'm going to give a scenario. We have a young woman who comes from a very close-knit, tight community. This community is, they have their beliefs, they have their values. And this young woman is trying to come out of the shackles of the mindset that the place of a young woman is in the kitchen. She's trying to come out of that shackle of women are not supposed to talk about reproductive health and rights. Women are not supposed to talk about contraceptives. When I go to a facility to seek information on HIV, information on contraceptives, I need to have a man beside me. So this young woman works in a facility to seek information. And we know that the Gen Z are very hungry with they want information. They're very hungry. They want to get to know what is happening. We saw in Kenya a few months ago, we changed the narrative. We went to the street and said, we reject. And that shows that we are not waiting for the future. We are the future right now. So this young woman works in a facility to get information. And she meets a nurse who can pass as an auntie or a mother. And she thinks, what will a nurse think? Because we know that when a young woman seeks information on contraceptives, people assume that, are you having sex? Are you promiscuous? So, like I said, the young women are very aggressive. She decides to go and seek information. And she asked the nurse that, what are the available HIV prevention and contraceptive methods? And the nurse proceeds to ask her, are you having sex? Why can't you wait? What is the rush? There's nothing you're missing. And immediately we see that this young woman is put in a dilemma because she walked in the facility knowing that she's going to meet a practitioners who knows values, clarification, attitude, and transformation, meaning that you need to know when and where to use your values and not to impose them. And young women, again, and adolescents, they don't want to be in a space where they feel like someone is judging them. They don't want to be in a space where they feel like you're forcing them to do what they don't want to do. So this young woman decides, you know what, I need that information. But again, the nurse feels like she's too young to get this information. She's too young to know about sex. She's too young to know about contraceptives. And she just brushed off the information, and the young woman decides to leave. And she leaves the facility without options. She leaves the facility without choices. She leaves the facility without information. And we know the moment a young man goes back to the community and Google about sex, you know what they're going to find, right? What are they going to find? We might stumble on porn, we might stumble on information that is not age appropriate, right? Yes, so from the scenario that I've just said, it's obvious that the health practitioner that has not gone through VCAT, and she doesn't know when to give age-appropriate information on comprehensive sexuality education. And she leaves this young woman with no choice but just to go back to the community without information. So that is an example of what young women face in the community. And you can imagine a scenario where when she leaves the facility, and it's a community, the hospital is very crowded, and she has a health provider saying, people who came for ARVs this side, people who came for treatment or infection this side, do you think this young woman is going to sit there and and just wait on the line for her turn? No, why? Because already she feels that her privacy is already exposed because she can't be in a space where people know her business. So I've talked about choices. So I can say I have nothing to disclose. So I've talked about choices and option. And what that choice means to you is the ability of an individual to have a array of options. You walk in a supermarket and you find you have Coca-Cola, we have Fanta, we have Sprite. So you get to choose what you want, right? You're not forced to take Coke because that is the only thing available. And for the option, we want options that are safe, options that are available, options that are sustainable. So what are the options available right now in the market? One of them is condom. And again, young people don't want to use condoms. Imagine a scenario where you are at the heat of the moment, and then you realize you don't have condom. What happens? Will you pause and go and get yourself a condom? No. So, it's obvious. Like young women, young men, they want quick solutions. So it's obvious condom is the best, 99% when it's used correctly. But again, it's not the best solution. We have the PrEP where, again, our beautiful story told us how she got tired and she decided to take a break. Young people don't want to keep taking pills, popping pills day in, day one. They want quick solutions. They want quick solution on, PrEP. Young people, again, they don't want to feel like, wow, I forgot to take my pill. What will happen to me? The same with postnatal, when the next morning you had an oops moment, and then you're forced to take the pill, maybe in a situation where you can't access the pharmacy, and then you're put in a dilemma. You don't know if you got HIV. You don't know if you're going to get pregnant, all that. So again, young people want solutions. They want quick solutions. I remember very many years ago, when people are told, you need to get tested, and going to the facility to get the HIV test was even more stigmatized, because I don't want to be in a line where I'm waiting and someone knows that Mariah came to be tested. And it's good because technology evolves every day and we have options, and nowadays it's even easier because you'll find yourself, you can just go to a pharmacy, get yourself a test kit and test with, in your own space, privately, and people don't have to know your business. Again, young people don't want their business out there. They want hush. I don't want people to know that I'm having sex. I don't want people to know that I'm testing myself. So, and of course, abstinence. This is the most powerful, the most effective way of preventing HIV. But again, you cannot tell a young person to abstain, because why should I abstain? And sex is nice, sex is pleasurable. Why are you telling me not to have sex? Give me a solution, but don't tell me to have sex. But again, no one, if I ask you how many had sex today, who will raise their hands? Really? But in a room full of 100, 200 people, only 3-4 people. But if I had a measurement, or rather a tool where I'm measuring how many people had sex, how many people will come to the front? No one, right? Again, that is how young people want to be. They don't want their business out there. So why is choice important? One, it puts African women and girls at the center of decision-making and leadership position, while fostering the culture of belonging and ownership. Again, when I go to the community and nowadays, when you use bottom-up approach in Kenya, it's associated with their politics and our president, because, he doesn't keep his promises. But in this room, when you use bottom-up approach, is where we want to go to the community and ask the young men out there, what do you want? I don't want to come and, I'm busy building hospitals or I'm busy building classrooms, and in real sense, you just want water tank, So that is why I'm saying you're going to use the bottom-up approach. And again, why is choice important? Because it focuses, invests, and prioritizes adolescents, girls, and young women in Africa as they navigate through their different stages of life. Again, you can't say because condom is good, so it's going to be good to me. Maybe I'm reacting to condom, so I don't need to use condom. So no, one size doesn't fit all. So we need to have options. We need to have choices that are affordable, sustainable, and available. Again, why it's just important. It's conceptualizes by the community and responds to the community needs and wants. Again, like I said, we need to go back to the community. We need to ask those women, what do you want? Don't just sit in the bedrooms and decide young women need well. Like, I feel the female condom, I don't feel like the women were, are involved, because how can you just decide that you're going to need 2 rings, and then that's good for the women? Like someone sat somewhere and, decided to take a rubber and you're going to have 2 rings. And again, is female condom very popular? No. Is it popular? How many people have used female condom in this room? You've never. Is it available? Is it affordable? It's not. So that means that people who decided to come up with female condom, they didn't use bottom-up approach. They didn't come to the end users who are us women, right? Yes. So another reason why choice and option is important is because it follows the science and use epidemiological evidence to make sure options available to women and girls are vulnerable to HIV infections. And of course, that's a beautiful picture of Mariah where we're holding a DPV ring. And these are the choices available in the market right now. And I remember the first time I had, I came to contact with the DVR. It was very interesting because I went to the community and I sat my girls down and I told them, this is the DPV ring. What do you think about it? And I allow these women to touch it. And I allow them to ask questions because at the end of the day, we said they are the end users. And even the boy child were involved because they had some questions like, what if I'm having sex with my woman? Am I going to feel the ring? What happens when she goes to the washroom? Can it come out? So those are the questions that, we as the CSOs, when you go back to the community, we need to take so that when we are making sure that the product is finished, it's going to go back to the community and it's going to be used. Not like the female condom, which is available, but again, it's not available because it's not, a useful product. And you have the Kabale, and these are the long-active HIV prevention method because we know that I said young people don't like popping pills. Young people they want quick solutions. And we have another choice is called the dual DPP, dual pill prevention. And that is, once it's, it comes to the market, it's going to be a game changer. Imagine a situation where you have a drug where it's protecting you from HIV. The drug is protecting you from pregnancy. Isn't that amazing? Yeah? But the opposers will say, are we not exposing our girls to live carelessly? Because when we say we have all under one roof, that means I can have sex and I'm not going to be worried that I'm going to get pregnant. I can have sex and I'm going to be in a space where I don't have to think about HIV. So that means that I'm going to live a careless life. What do you think? Are we exposing our girls to living a careless life? No, right? Yeah, so another photo of us just holding the DPV ring when we are disseminating in the community, and this photo say, how much longer will women wait for the ring? The women need this ring in their communities. They need this ring in their houses, in the supermarkets, everywhere, because we know that when the ring is here, it's going to be a game changer. For the sex workers, most of them, they find themselves in a situation where they have to negotiate. When you have sex with me without a condom, I'm going to give you $50. But when you use a condom, I'm going to give you $20. And then I'm in a position where I need to think, money on my health. So we don't want to put our women in a position where they need to balance between whether to take the money or not. So, that's why I'm saying we need the long-active methods with the women. Another photo of us just enjoying ourselves. Sorry, what happened? Sorry about that. Technology. Yeah, just go next. Where do I click? Yes, there. Yes. So, what are the recommendations? Adolescent women and girls have different ones, and we want to use the bottom-up approach. Behavior change communication, that is the BCC, and awareness can help reduce stigma and new infection rates. Sorry, that means that we have to have regular testing, correct and consistent use of condom, having a fully functional youth-friendly center. And what is a fully functional youth-friendly center? I want to work in a facility. It's not just a building, it's written YFS. No, I need to go to a facility where I am going to get information, correct information that is age-appropriate, correct information. I need to get services. I need to get a provider who has gone through, VCAT, because I don't want to be in a space where I have gone to seek for information on contraceptives and someone is busy telling me about scriptures and what the Bible says about you shall not fornicate, fornication is a sin, blah, 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 blah. So, we said having a fully functional will help the providers to disseminate and provide adolescent women and girls with available long-acting options such as the DVR, the Kabale, and the dual pill. Yes. So another recommendation is the AGIW living with HIV can reduce self-harm and adhering to antiretrovirals that will reduce the viral load to undetectable levels while lowering the risk of transmission. And then the vaccine and research, such as long-active option that will allow AGIW to have an array of options to choose from. I said, go to a supermarket, you have an array of options. You don't have to be limited to go with what is available. No, we have to have an array of options. And then the other one is accelerating long-active options that allows interventions that are specifically designed for adolescents to address their psychological and social need. And the last one is the VCAT, the service providers. Again, people need to stay with their beliefs and values when you're in a working space. Just respect me, give me what I want, and let me go back home. So recently, a few months ago, we developed a very beautiful document. And you know that Kenya is, they are known to developing good policies. But what happens? They are put under the desk. Yeah, so as we develop a very beautiful document, it's called the Choice Manifesto Launch. The Choice Manifesto document. And what is our goal? We want a future free of HIV for our daughters, women, and women in Africa. And basically, just a bit about the Choice Manifesto. So it follows the sciences and use epidemiological evidence to make options available for women and girls who are vulnerable to HIV. So if you forget everything that I said, just remember that the Choice Manifesto is advocating for options and choices, options that are available, sustainable, and affordable. So again, includes choice among the both prevention options and programs for women and girls to prevent HIV as they navigate through the different stages of circumstances of their lives. And the other point is focuses, invest, and prioritize adolescents and girls and women in African and African descent across the world. And it puts African women and girls at the center, not only for research, but also for access to products that are shown to be safe and effective. I said I was involved from the beginning of the DVR. So that means I have a sense of ownership, and I feel like, this is my product. So if anything goes wrong with it, I am to be blamed because I was there from the onset. And then the other point is it's conceptualized by the community and it responds to the community need. And again, we know if people didn't, append their signature, it never happened. If people didn't take photos, there was nothing, no face, no case, right? So we see that we have Winnie who is, trying to adopt the document and making sure that, she's with us, and she's, joining hands with us to make sure that the Choice Manifesto document is disseminated in our communities, in our regions, in our countries. And those are the launch moments. We have beautiful women, powerful women who are very excited about adolescent women and girls and their needs and their SRHR needs. Yeah. And then again, we have, signatures from different CSOs, different women who believe in us. So thank you so much. That was my time.